So a topic I want to talk about today is treating the tear troughs, which is basically a depression that people can develop under the eyes. And A, we're treating the depression. B, it can make it look like we have bags under the eyes. So it's really become sort of a hot topic, if you will, in our field. Primarily because we now have a lot of fillers that have been used in that area. So previously it was a difficult thing to treat unless we did surgery, namely a blepharoplasty or lower eyelid lift. Now that we have all these fillers, there are more and more doctors treating these areas with fillers instead. The idea is, rather than doing a surgical eyelid lift, well, let's just use a filler to kind of camouflage the eye bags or fill in that tear trough. I would say it's something that can be done, but with a lot of caution needed. It's a tricky area in that the skin here is very thin, so you want to make sure you see someone who's a real expert in treating that area and really talk about the pros and cons of that. There are times that surgery is still the better option. It's going to give you a longer lasting result, and it can actually be safer than even a filler, so you really have to have a thorough conversation with your doctor about that. If you are going to have that area treated, also consider carefully which filler. Some are definitely better for that area than others. Unfortunately, I do see patients who come in who've had treatments there elsewhere and then end up needing to correct it for them. So again, it's a choice of filler, being conservative about how much and where that filler is used in that area, and then considering if that is really the best option over surgery. So bottom line is, yes, the tear trough can be treated with fillers, but again, seek someone who's a real expert at it and have a real thorough conversation before you do it. And if you do that, you can get some great results there.